Welcome to Hoag Orthopedic Institute. We are so grateful you chose us for your orthopedic and spine care. Our expert team of specialized orthopedic and spine doctors, nurses, and caregivers are here to get you back to you. At HOI, our doctors are board certified and fellowship trained exclusively in orthopedics and spine specialties. The medical team that supports our doctors are also trained to care for orthopedic and spine conditions to ensure patients receive the best patient-centered care with quality outcomes. We want to best prepare you for surgery at HOI. Throughout this video, members from our team will walk you through the patient experience so you can see for yourself the dedication, expertise, and environment that sets HOI apart from the rest. From the expert team members to our healing environment of individual rooms with comfort amenities and the latest technology. Let Hoag Orthopedic Institute help get you back to you.
Our admitting associates are one of the first staff members to greet you on arrival to HOI for surgery. Our goal is to help you complete all admissions paperwork and address any concerns or questions in advance, so you feel prepared and ready on the day of surgery. We first reach out to you 2 to 5 days prior to surgery so we can pre-register you for surgery. During that call, we go over any estimated cost of your financial responsibility for your surgery and confirm personal information and answer any questions you may have, including Medicare questions. We also collect your financial responsibility, such as copays, so that you don't have to think about it or bring your personal information on day of surgery. We are often asked by patients when they should arrive for surgery. Please know that your surgeon's office will let you know when you should arrive and your surgery start time. For the most current visitor requirements, please visit our website. When you arrive on the day of surgery, our admitting associate in registration will greet you, provide final consent forms for you to sign, and complete your registration process. We then alert the pre-op team of your arrival. We also ensure each patient fills out a contact card with their support person's contact information, which is used by the Hoag Orthopedic team to update your support person on the status of surgery so they can visit you as soon as possible. Your support person may wait in the designated area during the initial pre-op surgery prep. Your pre-op nurses will call your support person to come up prior to going to surgery. Our goal in registration is to make you and your support person comfortable and informed and ready for surgery, so you have a seamless start to your HOI experience.
Once you arrive at HOI, our preoperative staff will warmly greet you and your visitor in the lobby. We will escort you to the preoperative unit on the second floor and instruct your visitor that we will call them to join you in approximately 1 hour. Once you have changed into your gown, we will assist you into bed, help adjust your head and feet to make you more comfortable, and offer you a warm blanket to soothe you before surgery. The preoperative aides will prepare the surgical site and obtain your vital signs. Then your preoperative nurse will review your medical history, home medications, and obtain any other information to ensure that you are at your best for surgery. Our expert staff will begin your IV using methods that will minimize your discomfort. And if you are experiencing any pain or anxiety, our team members will comfort you, and we even have virtual reality goggles to help you relax and provide distraction. You will then receive medications that will minimize your pain and nausea after surgery, and your visitor will be invited to join you at the bedside while awaiting the arrival of our OR team.
It's important for patients to know that it's not just their surgeon who is an expert. Our world-class team is made up of the sterile processing department, who sterilize the instruments used during surgery, nurses and surgical technicians, many of which hold additional operating room certifications. We do a great job of putting the right team together with each surgeon, making the cases flow efficiently and safely. Before surgery, the anesthesiologist and OR nurse will meet you in the preoperative area to ensure you are comfortable and know your surgical plan. A regional block may be done in the induction room before moving you to the OR. Upon arrival to the OR, your nurse will introduce the OR team. The OR nurses will begin to position you for your surgery, and then the anesthesiologist will give you your anesthesia. During the entire surgery, your nurse will ensure you are comfortable and safe, and the anesthesiologist is also there to ensure everything goes smoothly while the surgeon and surgical technician are working. We have the best instruments and newest technology, and because our team is so experienced in orthopedics and spine surgery, the time our patients are in surgery is greatly reduced, contributing to our low infection rates. Our ORs are equipped with the most advanced HVAC and HEPA air filtration systems to ensure the highest level of cleanliness, and our staff adheres to strict protocols recommended by AORN, CDC, and other governing bodies to ensure our patients and staff are always safe.
After surgery, you will be transported to the Post-Anesthesia Care Unit, or PACU. Your PACU nurse has already completed a thorough past medical history review prior to your arrival. The anesthesiologist hands off a full report, and the OR circulator reports any important details about your surgery to your PACU nurse. Our HOI PACU team consists of exceptionally skilled nurses, highly trained in post-operative orthopedic and spine care. Our primary focus is to ensure patient safety, your pain is controlled, and providing outstanding customer service to help you transition well from your surgery to your individual patient room. The PACU support staff further assists our patients in ensuring patient needs are met, and each feels comfortable and supported after surgery. We also update your family or support person once you are stable before transitioning your care to the medical surgical nurses on the floor.
As an HOI patient, you have a multidisciplinary team that truly works together to provide the best patient experience. From your nurses to care manager, dietitian, surgeon, internist, physical and occupational therapists, we work cohesively to make sure the transition of care in the hospital to home goes smoothly so we can get you back to you. Once our patients come to the floor into their private room, our job in the medical surgical unit is to make sure you're comfortable and medically stable. During the night, the hospital may appear to be louder due to the quietness of the unit. We provide amenities to help you relax, such as eye masks, earplugs, and aromatherapy. Our goal is to get you up and moving as soon as possible. This would also occur during the night shift. When walking to the bathroom or in your room, you will always be accompanied by a healthcare personnel for your safety.
At HOI, we use a multimodal pain approach to care, including non-narcotics like cold therapy, relaxation and distraction techniques, including relaxation videos on demand and virtual reality. A big part of our job is to be a patient advocate and educate patients, family members, and caregivers to help everyone understand the plan of care and recovery after surgery. You can expect that you will receive nothing but the highest level of care at Hoag Orthopedic Institute. As nurses and caregivers at HOI, we are all highly educated and trained in orthopedic and spine care, and many staff have advanced degrees in national certifications. Our team is always researching and looking for ways to enhance and improve our patients' care.
The role of the care management team members is an important one at HOI. Much of the work of this team goes on behind the scenes. Care management, also called case management, is a team of experienced nurses and social workers whose goal is to prepare you and your support person for discharge after surgery. Our first interaction with you begins with a chart review prior to surgery to ensure the appropriate insurance authorization is in place and identify any potential discharge obstacles so those are addressed prior to your arrival at HOI. One of our care managers meets with you and your support person either the day of surgery or the following day. We work closely with a multidisciplinary team consisting of your surgeon, nurse practitioner, nurse, and physical therapist to make sure you are healing and on track for discharge and that you have all the support you need to recover. Whether we order home equipment, arrange post-acute care, or provide a list of necessary resources, our care managers provide support and help you navigate through your HOI journey.
Physical therapy plays a vital role in your recovery post-surgery. Our specialized physical therapy team will evaluate you and ensure that you and your caregivers are educated and prepared to manage mobility and basic activities of daily living upon discharge. Preparing yourself by remaining as strong and active as possible prior to surgery is essential to a smooth and successful recovery. This, together with preparing your home and establishing a capable and reliable support system, will facilitate a positive post-surgical outcome. A physical therapist will evaluate your mobility and functional ability and initiate a physical therapy program during your stay in the medical surgical unit. Treatment focuses on post-surgical exercises and managing activities of daily living such as transfer training to and from the bed, chair, toilet, and car, and walking on even and uneven surfaces such as stairs. The physical therapist works with you to ensure that you are correctly using the appropriate assistive device for steady and safe walking. Another important role of ours is to provide you and your caregivers education about your assistive devices such as walkers or braces, post-surgical precautions, weight-bearing status, and safe progression of activities. While in the hospital, you may meet with a physical therapist on one or on several occasions based on your needs. Your physical therapist will perform ongoing assessments to ensure you are ready for discharge. Our experienced physical therapy team is excited to work with you as you begin your recovery and take the first steps in getting back to what you love doing.
Nurse practitioners are an integral part of the orthopedic team at HOI. As an advanced practice clinician, the NP provides quality care to patients and provides leadership to the nursing staff. We are the bridge between the surgeons, the hospital staff, hospitalists, and patients. Our purpose is to optimize the patient's care and stay at HOI and to prepare the patient and family for discharge. We work collaboratively with the surgeons at HOI in this unique physician extender role. While the surgeon is in the OR or in the office with patients, the NP is on the floor making rounds and answering nurses' calls and questions. Within the scope of practice for the NP, it is the ability to assess patients, order tests, prescribe medications, diagnose, and treat patients in a timely manner. Having the NPs on hand daily to follow patients adds value to care in several ways. It improves continuity, comprehensiveness, and standardization of care. It ensures the patient and family education is comprehensive and thorough. It increases timeliness in ordering and interventions, and enhances peace of mind for the patients and the physicians. A nurse practitioner may stop by to see you while you are in the medical surgical unit. We take care of paperwork, documentation, place orders, and provide prescriptions as needed, and review medications and discharge instructions with you and your loved ones or caregivers. This is all while keeping your surgeon in the loop to ensure seamless care. Even though our interactions with patients may be limited to the hospital, we work closely with the surgeons and nursing teams to support you and ensure a smooth transition into your recovery, to help you get back to doing what you love.
We hope this video supports you in preparing for surgery. Please do not hesitate to reach out to our team if you have any additional questions, and make sure you review your pre-op patient video and handouts online at HoagOrthopedicInstitute.com. Thank you for choosing Hoag Orthopedic Institute. At Hoag Orthopedic Institute, we get you back to you. Orthopedics and spine, it's all we do.